Hi everyone, this is Neel Raithatha here, consultant, audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with a severe wax impaction in this their right ear. They were experiencing extreme otalgia, so ear pain, of course reduced hearing, and they called up today and we were fully booked, but they were really desperate, so I decided to just keep the clinic open and squeeze them in at the end of the day. And they were very grateful because their symptoms just developed this morning. They did have some symptoms prior, so they were aware that the hearing was reducing gradually, but there was no pain. But what they did this morning, they instilled some, I think it was hydrogen peroxide drops, and after doing so, their symptoms exacerbated. So what's happened is that the wax skin, so it's a lot of skin as well in here. You'll see this skin at the bottom that I'm suctioning away. It absorbed the drops and it caused the plug to swell and expand and further compress. And they then began rubbing the entrance of the ear, and that became sore, and there's a bit of swelling there and a bit of tenderness. And so this plug has formed in the midsection of the ear canal, and the midsection of the ear canal is significantly larger than the entrance. You can probably see that the canal walls, they narrow in and then they widen. So this plug is stuck in the wider part of the ear canal, and because it's such a hardened plug, it's difficult to remove. And I'm going to, in the end, revert to the ear hook. That's what really helped me to remove this. And so the left-hand side of this plug is actually hidden away behind that swelling. So you can see some cartilage to the left, some flesh. And if you just immediately beyond that, the ear canal is significantly wider. So it's almost like a keratosis obturans in that respect, because with a keratosis obturans, it can widen the plug. The plug can widen the ear canal, which can make it much more difficult to remove. But this is not a keratosis obturans. There is a lot of skin, but there's also a lot of wax there. Keratosis obturans is purely a dead skin plug, an epidermal plug. And so I just used the hook there, and I managed to get it over and beyond the wax plug, and I was therefore hoping that it will come out in one piece, but it just cut through it. So I'm now just gliding the hook on the anterior canal wall and then rotating it so the tip goes into the center. And although it didn't remove the plug, it did take some away. So with this plug, the lateral surface is quite soft. That's where they've used the drops. So the drops have softened the lateral process, but you can probably see in the distance it's almost pitch black. And that's the harder piece of wax. And here's that skin. So I'm just trying to peel it into the midline. Now that I've managed to take away some of the surface of this plug, it's easier for me to drag some of this skin into the middle. There's no obstruction there. There's nothing impeding its path. I'm just trying to drag it down. It's quite mushy, so it is blocking the suction probe. So I'm going to come out in a moment, possibly to unblock it, or maybe it's just unblocked itself. Again, because it's skin, there's a lot of reflection there. So I'm just going to stretch open the ear again. I'm just now going to use the right correct to see if I can get in between the plug and the canal wall. So I've managed to lift it forwards a bit, and now I'm gliding it in between the canal wall and the plug. And because I've managed to separate some of it from the posterior canal wall, I'm going to go over the top and almost cut through this. I want to just remove this mushy stuff out of the way now so we can focus on the harder plug. There we are. So again, just going to stretch open that ear. It's hard to insert the speculum any further because there is, as I mentioned, there's a bit of swelling there at the entrance. So possibly I could have used a smaller size speculum. That might have dilated the ear open a bit more, but I felt like I was doing okay with the medium size. So the speculum that we're using, you can see the rim of it. This is a good angle, actually. As you can see that the V shape of the ear canal, and then so it's quite narrow in this section. So the speculum is just not going to go that deep to stretch this open. But this plug, it's filling up that space behind that narrowing. So I'm going to go to the top I'm going to see if I can peel this downwards. Now, there's a few hairs in the way as well, so not only is it a narrow entrance, but it's also a bit hairy. So I want to do this in layers. So I'm getting the outer layers away. I think I've just put some drops in. There was a bit of fungal involvement. You've probably seen a few spores already. This patient, we've recommended some antifungal solution drops. They do swim a lot and they do take precautions, but because of the wax, they were saying that their plugs just wasn't fitting into the ear. So hopefully now, well, we've advised them to stay away from water for a period of time whilst they're using the antifungal drops, just to make sure the fungus is completely eradicated and doesn't resurface. So again, I'm going to go to the bottom of the ear canal. I'm trying to lift it up, but it's just too stubborn. So the consistency here has changed. Now the wax is quite solid and hard. So I've kind of think I've given up on that approach. So you're just going to use the hook. I'm going to go over the top. I'm going to turn it and I'm going to pull forward. So it does come forwards on this occasion. So this, unless you're using manual instruments or unless you recommend the patient to use drops and come back, it just wasn't going to come away solely with microsuction. The plug was just too firm, too hard. The entrance of the ear is too narrow. So I've managed to bring it to the outer third, so I'm just going to, you can see that there's a bit of a mouldy appearance, and that's some of the fungi there. So again, I'm going to go over and behind. Well, I'm going to embed it on this occasion into it, pull forwards again, and I'm going to probably do that again. I'm going to just separate this piece that's hanging out the ear, so this is visible with the naked eye. Probably use a bit of microsuction just to separate this, because I've cut through it, I've dissected it. So you've got different tones here. You've got a lot of white skin, you've got a bit of brown wax, and you've got this pitch black, more medial wax. Now, this is a thick layer of skin here that's to envelope the plug. And we know that because it's reflecting. It's a bit difficult getting the right brightness, because to reduce the glare, you normally bring down the brightness, but then the main wax plug will be just not illuminated enough because of the colour of it. So I managed to separate that skin. Again, we want to push some of those hairs out the way. I'm just trying to bring this, as I said, this part of the ear canal is wide. I'm trying to bring the plug into the midline, but it was just too rock solid. So I think I'm going to go back to the ear hook. There's a gap there at the top. I'm going to get over and beyond and then penetrate. And as I'm bringing it forwards, I'm trying to orientate it so it's coming around the curvature of the ear canal. Our ear canals are not straight, there is curves now. You see I've made a nice opening there now. So I've got plenty of space when I get completely in and behind. And then, so this bit just cut away. So I'm going to just go back in that gap. I'm just positioning the hook more to the left-hand side so I can get into the center of this plug. And now I'm just trying to bring it through as a tight squeeze. So I managed to remove that. You're going to just stretch and straighten the ear. There's the eardrum. Now the eardrum is macerated, so the skin is kind of somewhat broken on the surface. It's dried up, and that's an indication there's a lot of water getting into the ear. And that may have also triggered this bit of fungal infection as well. So we're going to peel that skin away. So this is just in front of the eardrum. And there's a bit of dead skin at the bottom. There's a bit of clarinetting here, so we couldn't remove all of it, but now when it's got a layer of skin like that I just removed, but it's a bit wet, you just want to make sure there's nothing underneath. If it's a bit thicker, it's generally okay and it's dry. It's when it's kind of moist, damp skin. So I'm just going to stretch open the ear. You can see it's almost like a chalky appearance on the eardrum. I'm going to get it in focus. they could hear significantly better. So that's that plug. You can just see the different colours there. Pitch black, you got some orange, you got some white dead skin, you got some matted hairs. It is a bit of a monster looking plug. And that's just from a different view, different side view. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.